This is Dr. Manvantar. I'm a pediatric intensivist at the hospitals Bengaluru, and I'm here to share some knowledge on what to do when your child is having a seizure. Firstly, you need to know what are seizures. Seizures are episodes of movement or behavioral changes caused by additional electrical activity in the brain. They can range from subtle flickering of your fingers to obvious to and fro movements of your limb. Occasionally, they also present as sudden change in behavior like staring or not responding to commands. However, most of these last for a few minutes and often stop on their own, but it is still scary to see a child having a seizure, so it helps to know what to do. Once you've identified the child is having seizure, do not panic. Most of these episodes, they stop on their own. You will have to place the child on a flat surface, soft if possible. Try to clear out the surrounding area so that there's no secondary injuries. Turn the child to one side so that any secretions in the mouth come out rather than go inside and choke. Look for any breathing difficulty the child is having. Try to time the seizure just to see how long the seizure is going to last. Lastly, if you already have a prescription of medication to administer during a seizure, keep that in handy. You might have to administer that. Here are a few red flag signs that you need to know when you need to seek emergency medical care. First, if it's the first seizure that the child is having, or any seizure lasting more than 5 minutes, or if the child is having repeated seizures without any break in between, the child is having trouble breathing, any discoloration of the face, bluish discoloration, white, pale discoloration, or if the child got hurt during the seizure, head injury or any other injuries on the scene, or if the child is sick, having very high grades of fever, lot of headache, then you will have to seek emergency medical care. Next, you need to know what not to do when the child is having a seizure. Firstly, do not try to hold the child down or stop the child from moving, as this can make the child very uncomfortable. Second, don't try to put anything in the mouth or hands, as this can cause other secondary injuries. Lastly, wait for the child to wake up completely before you give something to eat or drink. Do not try to give any medications or water when the child is drowsy or having a seizure. For further details and tips, visit your pediatrician at the hospital.